Okay, good morning, everybody.
Good morning.
I'm gonna go ahead and call this meeting to order. It's 11:39. Can we have roll call? Marina Medina,
Fernando Pérez. Captain Yoshio. Ismael Pizarro. Juan Gino Perazán.
Lindsay Vázquez, Berenice Vargas, Irma Primera, Kayla Flores, Catalina Agüero,
Freddy Cordova, District 8.
Sabrina Brasky,
Richard Chamberlain, Loretta Hall.
Erica Lopez, Rita Hall,
Kirk Estrada.
Jessica Price,
Colleen Rodriguez, Crime Stoppers.
Nancy Cadena.
Fernando Lozano. Jesse Hernández, representing Jesse Gonzalez. Gerardo Mayor.
okay, thank you very much. At this time, we're gonna ask for any public comments. No public comments? And, okay, our next step is approval of minutes of September 13, 2023. Do we have those, Maria?
Yes, there, it should be in your phone. Have your extra copy.
Okay, do we need to go over them?
For the first and second.
Okay, can I have, is there any change, anybody that wants to do any changes or they're okay with those?
I approve.
Okay, Jesse first,
Second.
Gerardo second.
Marina, if you want, I can take notes and send them to Earl.
Okay. Okay, for the administrator report, Dr. Chamberlain, do you have something?
Yes, I just wanted to say, of course, welcome to your health department and share a little bit about our think tank highlights. That was held on September 14th, which was right after our the most recent DAC meeting. And so within that, there was several different individuals and organizations that were present here. It was definitely a kickoff to start the momentum, to be able to break into some subgroups. And it was, of course, discussed within that meeting, since it was just an hour, that we do need more than just an hour. And a lot of us do know that, and that was proposed that there should be some type of seminar event that's, you know, an all day for us to put together a SWOT analysis and put together SMART goals for us to be able to have a clearer picture of exactly where we need to go. And so I did want to share, because in the moment, we had some technical difficulties regarding some of the interactive portion of the event or of that meeting. And so here's just some word clouds that were generated from the online survey form that was shared in that meeting that was collected via the QR code information. And so as you can see here, what can be done to help spread more awareness. And a lot of this is stuff that we already know. But one that stuck out to me, and that's kind of going back to like the grassroots portion of what we do in public health, is the knock and talk. I hadn't seen that, and that was something that was new and maybe something that we can exercise as the collective organizations that are part of this group. Two, what is your organization doing for prevention awareness? Education, conferences, parents and students, information, community resources, educational presentations. And so this is something that we know, but it's good for us to get that out so that way we're all aware of the different awareness and prevention strategies that are being exercised. And I can definitely share this information with the group, and I'll have that sent out if anybody would like the raw data. What action steps is your organization taking? Medication utilization, access to Narcan, training for use of Narcan, awareness for the community. So these are some of the responses that were collected. Fourth question was, what resources and support are needed to sustain harm reduction initiatives? The big one, as you can see from the word cloud, is funding. We do know that that's a significant element in what we do with all of our actions. But it can come back down to the simple action that can be conducted within the classroom setting or within the household setting it was discussed that we do have a culture of the no pasa nada in Laredo. It's just a little alcohol that they're given or a cigarette, no pasa nada. But that culture needs to change. And that's something that we did discuss within that meeting, because it's not no pasa nada. It ends up snowballing into an addiction or health problems and concerns for that specific individual or the families that are part of the family and friends and social circles of that individual who is suffering from substance use disorder. And are there more innovative approaches to making naloxone more accessible to the public? There was, I mean, as you can see, there are billboards, parents and staff, the distribution center. I know we don't have an official quote unquote distribution center, as there are many satellite centers that are providing naloxone. We just received our naloxone inventory at the city of Laredo, and we'll be working to place those within the specific zip codes. And actually, we have gotten together with our GIS specialist at the city of Laredo, who is housed within the planning division, so that we can start to make layers based on census tracts that does not exist in this moment. Of course, that information, we do have to de-identify it to make sure that we're protecting protected health information for any persons that are identified via fire or police, and we don't want it to be specific to their home, but at least within census tracts, we'll be able to see that so that it's de-identified. And we're very hopeful that we'll be able to layer this with, you know, car crashes and robbery and salmonella, whatever we can add to this layer of GIS maps is something that we're working on right now. And we're very excited that we do have a GIS specialist here at the city of Laredo, which is a very new feature for us to be able to exercise, especially within the realm of public health. I did also want to highlight that the mayor did visit New York City. He was invited to the New York City by Mayor Eric Adams to attend a mayoral summit addressing fentanyl crisis in the United States. And our mayor did identify that as we are the #1 port of entry in the country, plays a pivotal role in safeguarding our borders. However, it was emphasized that addressing the crisis requires a collective effort and cooperation beyond individual cities. And the summit provided a platform for mayors in various cities to discuss and share ideas on how to address the fentanyl crisis, comprehensively acknowledging the interconnectedness of the issues and the importance of international collaboration. Mayor Dr. Victor Trevino highlighted Laredo's unique position as a critical gateway for trade and emphasized the need for cross-border cooperation to effectively manage the crisis and enhance security measures. This was a great platform for him to be out. As you can see, he did have the presentation that has been shared here with this group, with DAC and at other events. They're on the screen highlighting that Laredo, Webb County, Texas cannot be forgotten as we spoke about in our past meetings, that more attention needs to be focused on our situation here. And that is, of course, at the congressional level, at the federal level, and within any organization that has the ability to expand on the prevention awareness strategies that we have initiated here in the city of Laredo. I'll pause there for any questions, and if not, I'll turn it back over to Ms. Padilla.
For Doctor. No. Okay, thank you. Well, we'll move on. We have, discussion and possible action. We have the subcommittee meetings. We need to set a date and time. If anybody's interested, I know, Jersey, you have some ideas on that?
But anyone that wants to be in the detox residential or the co-occurring psychiatric substance disorder, my preference is to have them on Mondays. I'm free on Monday. And we used to have them at about 4 p.m. And we were there, some other people that aren't here. But I'd asked last time around if you all can email me at my email address, puffmedia@laredo.r.com. Those that are interested, join. We'll set up some type of meeting through either Zoom or DoxyMe on my virtual site. and we can have our discussions about, phase two, once the detox is started, we talk about, how we're gonna do residential, and then also how we're gonna deal with co-occurring psychiatric and substance use disorders, because that's what we're gonna be seeing in the detox. And, you know, we are overwhelmed, and we have people from SCAN and I'm here, and they can attest that I don't see anyone from door, but our services are being overwhelmed by the people that have co-occurring disorders and have that meet the ASAM criteria for detox residential. We're not just dealing with people that would normally qualify. We're dealing with the priority populations in our programs. Heroin addicts, severe cocaine, severe alcohol. So we're overwhelmed in our community. So that's why we talk about co-occurring disorders. So anyone, feel free, email me. I'll be on the lookout. We'll set up a time. I typically like to have it at about 4 o'clock. I pick up my granddaughter by that time. I'm off on Mondays. So 4 to 5 is what I'd like to shoot for.
Zoom meeting?
Yeah, we'll set up a Zoom or we could do Doxy. I think I can handle it on my side up to 12 people.
If anybody's interested, we can, I think we have Jesse's email in our
Yes.
group, so if we wanna maybe get together this Monday, 16th or 16th.
That's fine.
We can
That's fine.
probably set up for that.
And, you know, whoever emailed me, I'll figure out the site and we can attempt doxing me or Zoom.
Okay, thank you very much. Membership updates. We have some updates here. I know the Dr. Trevino, Mayor Trevino, that spot's open, right, Colleen? Yes, spot's gonna be open. We're trying to see if we can get Colleen there since, the new mayor. I know Gerardo, Montemayor, he, got, District 1 with Gilbert Gonzalez. Daisy Campos, it's still empty. We want to welcome, Ms. Carolina Verástegui. She's with, District 3, Melissa R. Cigarron. Dr. Dominguez, Silvia Dominguez, she's still with District 4. Earl's our secretary. Mika's with, Dr. Tyler King. Elizabeth Alonso is, District 7. Freddie, District 8. Maras, Webb County, Judge Tano. Jesse, Precinct 1, Nancy Cadena, Precinct 2, I myself and, co-chair, Precinct 3 with John Galo. And I know we have empty, Margarita Garza, she never showed up for it anymore.
She was on leave. She just had a baby. She just came back to work this week, if I'm not mistaken. I got an email, but she was on maternity leave. So that's why she hasn't been at the meetings.
Okay, well, maybe we can follow up with, Ricky Hyman, see if she's still on or if we need to get somebody to them.
I'm in contact with her.
Okay, so you. let
And
us-
Freddie, you're also in contact with her.
Yes.
So we'll both contact her and remind her.
Okay, can you let us know?
Yes, yes.
Okay, thank you very much. Detox facility update, Dr.
I know we do have representatives from
Hi,
our
good morning.
Race Recovery Center here, and they'll
Good
go
morning.
ahead and introduce themselves.
Okay,
Good morning, everyone. My name is Lindsay Vasquez. I'm the manager for the detox center. With me, Berenice Vargas. She's our grant coordinator and public health and mission supervisor. And also I have Irma Proneda. She's our OPC. This is the first time of they're here. We are already in our final process for opening the detox center. We are hoping to have our ribbon cutting by the end of the month of November. So we are finalizing everything for our licensure process. So we're right on track, and by the end of November, we're hoping to be receiving our first group of clients.
I do have a question about the detox. And I don't know who will be able to answer it. Since 2013, for the first drug and alcohol, which now is up and down. The idea that the drug and alcohol commission had for detox was to make sure that the population from Laredo, the indigent population that had to go out of town, Corpus to get each from was serviced. I don't know if I'm right, but I want to confirm that that has been our plan always. Commission has agreed on it. We agreed that the primary services would be the people that were indigent here in Laredo, that we would have a physician that was ASAM accredited, that we'd have a psychiatric nurse as a detox nurse to run things. That was our discussions that we've always had. How? And the plan was, once we have the detox set up with the initial funding that was given to us, the idea was then to go after state grants, because you cannot use federal grants for detox. The state does fund detox. And right now, they're funding what used to be Charlie's Place, which is California Service Region 11, but I think we can make a good case here to get detox back. Now, some of you know that I understand the difficulties running a detox. I've run them. Okay? Many, many years ago. And I know that you just break even on it. And so we're gonna have to go out after these grants, but I found out, and I wanna know, what is a financial plan? Is it the case that the people that are gonna be going in primarily have to have insurance? Because if that's the case, then that goes against what we've talked about for all of these years. And so that is a plan that's out there, and I just recently found out. Then I want to know, is it the case that that's what's going on? Because then that would go against us, what we talked about, what we have stood for, because all of us here that work in nonprofits or have worked in nonprofits fought for indigent services. You know, I started working with indigent services 35 years ago, and even in my private practice, I do pro bono. And I make sure that my rates are low because of my consulting work. To provide services for those that are in need. We can't go back on our word. I don't know if you have the answer or you have it, Richard, but if what was told to me is true, then I'm very disappointed.
I can comment up until May. I don't know if there has been any changes on the operational side, but when the inception of this, of course, started with this group and exactly with what you're saying. And so the admission is voluntary and involuntary, and there was indigent beds that were added. 4 of the 20 were specific for indigent.
Right. It was supposed to be the other way around, respectively, Dr. Chamberlain. Not 4. We understood that there was going to be insurance and Medicaid there to supplement. The majority of the beds, correct me if I'm wrong, anyone, that has been with us, was supposed to be for indigent. And we were supposed to go after funding to make sure, from the state, to make sure that we had funding to support this. If you are saying that 16 out of 20 beds are going to be insurance-based, I'll be quite honest with you. And everybody here that works with this type of population, you know, in my private practice, I mostly see PTSD, but I still work with co-occurring disorder. When I need someone to be sent to detox residential, I send them to Purple or San Antonio. I will not send them here to Laredo, not yet, until it's a proven entity. I send them to places that I know they're going to get the help and that are proven. You know, and sometimes I've had to send to Charlie's because that's what's around. And that's what those are approved, but you know, they have insurance, I'm sending them somewhere else. And I'm sure that a lot of people that are in private practice or work, that's what we're gonna send them. I can't believe that there's gonna be 16, you know, beds for people with insurance and 4 for indigent. That's not our population. How could that be? You know, I don't know who came up with that plan, but it does go against everything we've talked about, isn't that right, Gerardo? Isn't that right?
20 insurance beds and 4 indigent.
No, 16 insurance beds, 4 indigent.
No, 20, right?
20.
Yeah,
20.
yeah, and only 4 indigent. That's ridiculous. That's not what we've talked about for years.
Yes, I'm sorry to interrupt.
Go
There's
ahead.
not gonna be 20, there's gonna be 24.
Okay,
And the idea has never been to just do insurance self-pay, and we're also gonna accept indigent. I don't have the number.
Is there
per
gonna be a
se.
ratio?
I don't have the number per se, but that's something that I can ask, Dr. Martinez,
Uh,
and I can get that.
I understand that. I understand that there has to be.
Yeah.
There has to be some insurance, some self-pay. I understand that. You know, when I ran detox, we had insurance, but we primarily had indigent. And we had people that could pay, yes. But the primary was supposed to be indigent.
Yeah.
And by the way, I do know the plan. I know it very specifically. I'm not gonna say how I know it, but I found out this week and I was furious. And I still am, because that's not what we talked about at all in. And you're just new to this. So I know you're new. This is not you. This is not on you. And if I wanted to, I could have asked and gotten the plan.
And like I said, I can get back to you. I don't know specifically that it's.
Well, I know this, I know specific plan.
I mean, of course, we do need to accept, people with insurance.
Of course we do. Of course we do. And that's part of it. But the main thing has always been, we have to serve our population, the indigent population that don't have anything. They don't have insurance. They don't have resources for detox. That was a whole plan from the inception, from 2013 to now.
They're the most vulnerable, they don't have the resources, someone that has insurance can go other places.
Yes, and they
But
will,
not to dis-
and they will go other places. I experienced that when I ran the detox. They didn't want to come here. They would go other places. Places that are more established. And I'm not saying that you all won't do a fantastic job and you all will have, do everything that you can to make it a great place. But we didn't talk about an ASAM accredited doctor. We talked about a psychiatric nurse to be the detox nurse. We need people that on the top understand addiction. And that's where all of a sudden, it's wonderful that you're opening up in November. You know, I've been there, exciting time, and I'm glad that you hired an LPC. And I think that one LPC is not enough, but it's okay. You know, it's a start.
Can you get back to us with
Yes.
information, please, so we can see what's gonna happen? In that case, Dr. Chamberlain, what happens? Like, it's just gonna stick to
So,
insurance?
so the business plan is gonna be ever evolving and the facility will not be filled, within even the first 6 months. It's gonna be a slow process from what I have been told from the consulting agency who guided the process to be done. And it'll be 4, 6, 8, it'll be a build up. And within that time frame, and built into the business model was the submission and hopefully awarding of grant funds to support indigent populations. And so that was built into it. As mentioned, they can get some more information from Dr. Martinez to be able to provide additional guidance regarding the operation at a subsequent meeting.
I understand stepping into it for 6 bed. We started thinking that when we had a detox at SCAN. It was full in less than a month.
You already have a waiting list.
Oh, I know, you probably have a waiting list. And you know what? If you saw the waiting list that we have, and when I say we, I'm the evaluator for the drug court and the veterans court, that hasn't even been presented to you. Those people go in and hopefully, all those people that are on the waiting list, they meet the criteria, but I can let you know that just with the people that are indigent, you can be full right away. Of course, I don't expect that because of the fact that you're right, you need to get some experience. You can't just bring in people. I don't know, what the dynamics are, how many staff you have, what your nurses are, who your doctors is. I'm meeting you all for the first time and I'm happy, but, that we're moving along. I mean, I do want the detox to succeed. But I'm just saying that what I heard the other day wasn't the plan.
So do you all know the people that are on the waiting list, if they have insurance? Do we know?
Most of them, they already have insurance.
They all have
most of
insurance.
them don't. It's like a balance between every population that we
50-50?
have. Yes.
Okay.
we'll wait for an update for next meeting.
All right.
And then you all can provide us private insurance, Medicaid, what kind of insurance? Is it public or private?
Both the,
Are you all, and you all are gonna follow the priority population? Right? So priority population are females, and I don't know if you're gonna have females right now, females that are, pregnant, substance
Yes,
use,
we
and
will
then,
have-
and then heroin addicts. Okay, I can let you know from my history and anyone that works nonprofits, how many heroin addicts that we know have insurance? None. And that's the priority population. Just like Board of Regent has priority population for schizophrenic, bipolar, and depression. Okay, there is priority population for this. That's just a standard.
Okay, well, we'll wait for your update then. Thank you very much. Thank you, Jesse. For the next, we're going to stakeholder agency updates and presentation. We did, get Mr. Eric Estrada from DPS to do a presentation. It's very informative, so
I have Tim try.
Maria, do you get that or?
Yeah.
Marina, meanwhile, around.
Do we have any, agency updates? No.
Steve here.
It's community.
The only thing that I have is, with Laredo Crime Stoppers, I just came back from a state conference, last week, and we were awarded, in the state of Texas, the greatest dollar recovery, which indicates that we unfortunately, fortunately, right, had the biggest seizures in narcotics, property and, money seized in 2022. We had over $3.8 million, coming in through calls alone through our tip line. Since we've actually received a lot of calls, from fentanyl, being sold on the street. So we've taken fentanyl off the streets this year. So we're hoping that we reach those numbers or exceed those numbers, in the coming year. But just wanted to let you know that that's our big success as a nonprofit organization, an office of one. It's a huge success. And so, I just wanted to share that with you all, that these collaborations and, these commission meetings really do help support, our nonprofit and the community's efforts in calling in to report anonymous tips and taking, drugs off the street. So, it's a big congratulations for you all as well. So thank you very much.
Congratulations.
Thank you.
Question regarding that. So regarding some of the forfeiture funds, can they be brought back to the community and used?
So they are brought back to the community. Each agency that was involved get a portion of it. Unfortunately, as a nonprofit, Crime Stoppers does not get any of that money. That money is coming back into the police with their equipment, their vehicles, their anything and everything. It does go back to the community, to our local community, as a matter of fact.
Well, yeah, sometimes nonprofits can apply for forfeiture funds, even like the Webb County Sheriff's Department has forfeiture.
All of those are at their discretion, so it's a plea for them to see where their monies go.
I have something else before. we can
No,
start.
go ahead.
Today was the kickoff for Red Ribbon Week at, Martin High School. So just so you know, we're gonna be having Red Ribbon Week from, October 23rd to October 27th.
Good afternoon, everybody. My name is Eric Estrada. Thank you, Marina, for having me. I've been to one of your guys' coalition meetings and then also do the Zoom meetings as well. You guys are not aware of this presentation. I'm not sure if anyone attended that Zoom meeting we had for SCAN. But basically, some of the issues that we're having are obviously with edibles, right? You see on the screen, most of these edibles are coming from California. We did catch a lady last year with a bunch of these. This is not an actual photo of what she had. She actually had more. She had Doritos, Flaming Hots, Cheetos, you name it. Obviously on the bottom, it had the THC emblem on them. Obviously, California is a different, animal when it comes to drugs and stuff like that, but this is something that's getting introduced into Texas that's very dangerous because a lot of these edibles, I mean, you could just imagine, hopefully, adults don't put this on inside their pantry, right, where children are able to access them, but this is an issue that we're seeing, and the problem with these edibles is that they advertise that they contain certain amount of THC inside of them, but the thing is, THC, we just don't know how much THC is in each one individual candy. So that's what's dangerous about these candies as well. Okay. Smoke shops, we all see them here in Laredo especially, right? We have over 20 smoke shops here in Laredo. Obviously, they have to abide by Texas regulations, right, with smoking. We know that the age changed from 18 to 21, so that includes any tobacco products, meaning zigzags, meaning, tobacco, nicotine, anything that includes tobacco inside, you have to be 21 years of age or older. So let's talk a little bit about hemp and marijuana. What are some of the main differences? It all comes from cannabis. It's still cannabis. The only difference is that hemp, it's gonna have that 0.03, right? That THC level has to be 0.3. So if it's 0.3 or lower, then it is legal to have here in Texas. That includes Delta 8, Delta 9, CBD, and then you have your hemp products. Hemp products were usually made for clothing. Some people would use it in farms, right? When we had that farm bill, and that's how it actually legalized here in Texas. The farmers went against, Texas, lawsuits went in and out, and they ended up approving hemp grow. Obviously, marijuana is still illegal. Marijuana, you see the difference as far as THC levels. It ranges from 5 to 20%. I can tell you, whenever I used to be on the road, I would stop a lot of marijuana users. But lately, what we're seeing with our DPS troopers is now people have shifted to vape pens. Why? Because obviously, whenever we stop a vehicle, right, and I smell marijuana, that gives me a probable cause to go inside that vehicle and search the contents of that vehicle. With vape pens, sometimes you don't get that order. So it hides that, it kind of eliminates that probable cause, and now I have to bring a dog in and stuff like that, but that's kind of where they're shifting. Also, it's more accessible. People are ordering in oils. But what these teenagers don't know is that oil, that THC concentration is actually worse than, having, let's say, a cigarette of marijuana. Not only that, but it's actually a higher offense. It enhances if you have pure THC oil inside that vape pen. So let's talk a little bit about those vape pens, right? Well, before we go into vape pens, hemp is still illegal if it's smokable. So if you have hemp oil, if you see anyone with hemp oil or anything like that, it's still illegal. And that's the bill, right, that got passed in August 2020. So the manufacturer, processing, distribution, or retail sale of consumable hemp product for smoking is prohibited. So any smoke shop that has hemp that's smokable, it's still illegal. They could sell it, but it has to be like in an edible form. It has to be something that you cannot put inside a vape pen, basically, or in a cigar. Little bit about vape pens. I know this is very popular. We see it with a lot of high school students that use it. Why? It's very accessible. They order it online, and it also how they advertise it, right? They say strawberry cheesecake, for example, on this one. They put all these flavors that basically are, something that teenagers like. They like these type of flavors and stuff like that. Vape pens, they vary. Some of them have Delta 8, Delta 9 oils inside of them. And then also they advertise them as having 0.3 THC or lower. So some of the side effects that we've seen, obviously they have anxiety, panic attacks, paranoia. So there's different side effects with these vape pens, but the most dangerous one that we see is the explosion of vape pens. Has anyone ever seen a YouTube video where a vape pen explodes? So this gentleman right here on the left side, the vape pen exploded inside his mouth. There's actually reports of people dying. And the reason that it explodes, obviously there's a malfunction inside that battery. But if you ever seen people that smoke vape pens, some of them, they mess around with that battery. They put a higher voltage battery. They mess around with it. They modify it in order for it to throw a bigger smoke, a bigger cloud of smoke. So sometimes you'll see people vaping, throw a little smoke, but then you'll see some people vaping and it just fills the whole room with it. That's because they mess around with that battery. And the reason that vape actually comes out of that e-cigarette, those are the e-liquid components, right? But I want you guys to pay attention to the one at the very bottom, the glycol. So glycol is actually found in antifreeze. So when your vehicle overheats, right? Or the cap comes off or whatever, what's the first thing you see? That big cloud of smoke, right? So that's one of the contents, or that's one of the ingredients that actually is found in one of those e-liquid components. Another question that I get is, okay, well, we're trying to get, we're trying to be safer, we're trying to be more clean, so we're switching to these Juul pods or this puff bar, right? Because they're less dangerous than nicotine. Well, actually, no, in one Juul pod, it has been found that it equals about 20 cigarettes. So if you have one Juul pod, you're actually smoking almost a whole pack of cigarettes. That's basically what it kind of equals to. This is it's kind of blurry, kind of like got it from YouTube, but you'll see in this video where the vape pen basically explodes. And just look how hot that battery is, how hot it gets.
Maybe they'll quit now.
I hope so. I mean, that's what we're pushing for, but just imagine that would have, exploded inside his mouth, and you could see how hot it still is. The guy tries kicking it away and it's still burning hot. It's still lighted up. Doctor, please correct me the pronunciation. Kratom? Kratom. Yeah, kratom. Kratom. So I searched online for both. Some people say kratom, some people say kratom. I don't know. I'm gonna say kratom, but. So kratom is another popular thing that is found in these smoke shops. It's supposed to be good for like an energy boost and low dosage. And then higher dosage also is supposed to help out with pain and stuff like that. But excessive use obviously becomes sedative. So there were about 1,800 calls made to the poison control centers from 2011 to 2017. There hasn't been enough studies done on kratom to know if it's dangerous or to even know if it's helping. So it's kind of like one of those in between. But smoke shops is very popular, just like CBD is. My question is to because then obviously we're not kids here or teenagers, but it kind of seems like these teenagers are very high energy and they kind of like want to lower down on that energy. So a lot of them use Prozalup, right? What is it called? Xanax pills and stuff like that. They kind of want to go on that lower spectrum, which I don't understand why. And then you have your older people who want that energy boost. So it's very weird, but we see the side effects, right? Obviously, we have liver damage, muscle pain, nausea. It's popular. Why? Because the effects are pretty quick. It's from 5 to 10 minutes, almost like when you have like your cocaine, right? When people they use it, they snort it, or there's different ways of how they use cocaine. But the effects are pretty quick, and they actually last longer than what a cocaine would last, right? Like cocaine usually, it's like less than an hour, and the effects are gone. It's just quick, but this one pretty much lasts anywhere for 2 to 5 hours. Very popular here in Laredo. I don't know if you guys know, a lot of kids have this. I saw people with teenagers, young adults. Obviously your older people are usually prescribed medication for anxiety and stuff like that, but they have different names, different colors mean different things in pills. The generic ones are your white ones, right? The yellow ones, they call them school buses, especially like in San Antonio. I found out about this. And then we one time went to a jail facility in San Antonio. And one of the guys like, well, I took like two halts. It was a halt. And like, those are all the ones on the far right corner. And that's like basically like, it's like Xanax on steroids, like it's just very high dosage. So school buses, that, and then you have your halts and then your quiet ones. This is a traffic stop that we did, actually was, I believe, last month. This guy with a BMW, and if you guys are not familiar with this roadway, I wanna say which is the road that runs, it's Bartlett, and then the other one is. So Maliche goes south?
Yes.
Yes, and then this Bartlett's going up, right? So I wanna say the corner of this is, is this Waterford? Yes. Is that Maliche, or am I wrong?
That's Waterburger and that's Mark.
Okay, cool.
Just wait for me in the back. Guys, put your hands behind your back. You're under arrest for the possession of narcotics you have. Put your hands behind your back.
He had 400 doses of Xanax, and he was actually selling them. He did admit he was selling them in just local bars and stuff like that. And he gets them from his grandmother, gets them from friends, gets them from different people, which is why we always, and I know, Marina, you talked about this, how to properly dispose of pills, because there's opportunity, right? People will ask for them, hey, I need them, and then they'll start selling them and stuff like that. Salvia, I haven't seen this, but this is an interesting video. It's funny, but it's sad that, and this guy has a whole lot of videos from Salvia on YouTube. I don't know how it still hasn't got a flag, but he's still there. But salvia is a plant that is actually just, it could be grown and it's legal here in Texas. This guy tried to drive on it. He'll give us a lesson on how to drive on it.
Hello, and welcome to Driving on Salvia. I'm Eric, your host. Now, today we're going to take the car out onto the streets, and we're going to do some K-turns, and then we're going to do some U-turns, and then we're going to go ahead and parallel park in a spot smaller than we have before. To start it all off, however, we need to take a hit of our Salvia. But once you have that done, you're going to hold it in for about 20 seconds or until your vision begins to vibrate. At that point, you can start your car and you'll be good to go. In the meanwhile, check your mirrors. Make sure that they're pointing in the right direction. I'll be back in a moment.